A message from the International Foundation for CDKL5 Research. The IFCR is working to improve the lives of our loved ones with CDKL5 all around the world. We know that our patient advocacy organization is strongest when we work together. Has your family connected with us? Please join our Connect CDKL5 contact registry. It's quick and easy to do. Let the IFCR know who you are so that we can connect you with the information you need to stay up to date about CDKL5. The IFCR endeavors to have relationships with all companies and researchers who have an interest in CDKL5. We believe the patient voice needs to be central to conversations, and we want all CDKL5 families to be represented. Join Connect CDKL5 today. The International CDKL5 Disorder Database has been collecting information about patients with CDKL5 for a decade now. This ongoing research database, managed by the Telethon Kids Institute in Australia, has used data provided by CDKL5 caregivers to inform multiple important publications in the scientific and medical literature since 2012. Is your child included in their dataset? No matter where you live in the world, the database needs your information. Reach out to Drs. Helen Leonard and Jenny Downs to be included. It's an exciting time for CDKL5 research, but as a community, we have work to do. The ICCRN is working to develop and validate clinical outcome measures and biomarkers that are vital for future disease-modifying clinical trials. You can participate in this important work from anywhere in the world by completing the study surveys and recording the at-home videos. If you are able to travel to the US, you can be one of 200 patients we need to see for an in-person assessment in clinic. Any way you can participate, we appreciate you.
I would say that this type of clinical research that we're doing is how we take our clinical experiences and parent experiences and we convert them into knowledge. That knowledge then is available to all clinicians, to all families, to be able to improve the quality of care for all patients with CDKL5 deficiency disorder. I also think that specifically what we're trying to achieve with this clinical research is about being prepared for potential future trials where there will be disease-modifying therapies. What do I mean by disease-modifying? I mean not a Band-Aid. I don't mean a drug that just tries to help reduce some seizures, make them a little bit better. I mean something that changes the whole course of the disease, improves development, improves CVI, improves seizures, yes. But the whole package, ideally, is what we're hoping for as we start to move towards drugs like gene therapies or gene modulating types of drugs. In order to be able to be successful in a clinical trial for that type of drug, we have to know what's typical in patients and how do we measure that. And the how do we measure it part seems like it should be pretty simple and straightforward, but it's actually really complicated, particularly in a disease as complicated and with so many different types of challenges as CDKL5 deficiency disorder. So we're looking at development, or what we call validation, which means collection of data and showing that that data sees what we're trying to find and represents patients with CDKL5 appropriately. So we're trying to develop and validate measures that capture as many different facets of CDKL5 deficiency disorder as possible, so that when that drug comes along and is ready to be tested in patients, we're ready to be able to see whether it actually works or not, and how well does it work. Additionally, it's going to give us a better sense of how severe is an individual's symptoms when they start the trial. Is there any chance things aren't going well, that things are getting worse? And I think that's a really critical part as well.
Learn about all of these important initiatives at the IFCR's website, cdkl5.com.